CURA100 AI podcast. This is episode number 2, and we have put together all the coordinators of the initiatives that we have for the Hispanic Mental Counseling, the Hispanic Psychoanalyst, and most of the different different let me just go to hold on. Let me go to right here. So what we're trying to do is just to bring to you guys our recent research that the team had put together. The CURA100, it's a super group of clinicians, doctors, psychotherapists, coaches that has been working for the last couple of months, most likely very much organized, and the expertise and inspirations of Dr. Hamid, who pushed me to don't go on vacation, don't go on sabbatical, don't retire, just do more for humanity. And here we are. We have put together our podcast on AI, and especially in the area of the mapping, my mapping. So everybody mute, please, so that we can understand a little bit, the human behavior using AI, using a lot of in technology and neuroscience that exists nowadays. So that was our first episode. Today we're going to present the psychology of vertigo. Evelin Mateo is a psychologist from the R. She's part of the psychoanalytic movement and the new foundation that we have established in Santo Domingo. I went 28 days just to establish that, and with all the team and psychologists, accountants, technology guys that we put together, how we go about the science psychoanalysis, and also establishing psychology consult clinics and medicine clinic in Santo Domingo, especially in the south, in Centro Médico Gascue. So she's part of that. She's a board of director and she's a psychologist there, but also she is a mental health counselor. She's working on her license, and she's been my intern for a long time. She's going to present vertigo to all of us. It's a research that she has taken on her hands that we're very happy to introduce. So let's give welcome and introduce formally Evelin Mateo. We have two Evelyn. We have Evelin Fonseca in Chicago. We have Evelin Mateo in Yonkers, New York. And I am streaming directly from Kissimmee, Florida. So let's also present her by Kara Marie Uzun from Turkey. Let's have these presentations of our Evelin Fonseca.
Mateo.
Evelin Mateo, sorry, Evelin Mateo.
Thank you, Dr. Good morning, everybody.
Let's hold on. Let's wait for Uzun to present to you. Go ahead.
Thank you. I'd like to introduce Evelin Mateo, and I'm going to read her biography now. She is a clinical psychologist. She graduated from the Autonomous University of Santo Domingo in 1994 with a master's degree in clinical psychology and a graduate degree at the same university. Evelin has an advanced certificate in mental health counseling from Manhattan College, and her different specialties and certificates include conflict management, domestic violence, PACM, family counseling in situations for leaders, IMAFA, couples therapy and sexual therapy, and others. And she's studying to be a cognitive behavioral psychologist with the Latin American Association for Analysis, Behavior Modification, and Cognitive Behavioral Therapy with the approved diploma. She's a member and she volunteers at the Be Positive Digital Positive Psychology, LACA, Chaplains and Hispanic Association of Health Professionals. And Evelin has worked in the juvenile court in Santo, this just says in Santo, and as a school psychologist in San Cristobal, Dominican Republic. She's a family therapist through court in home-based juvenile cases in New York City. Evelin is also a therapist for immigrant minors from the border. And Evelin currently works as a support broker at OPWDD, Support for Participants with Developmental Disabilities, as a freelancer for different agencies in New York City and Westchester County. Evelin is a volunteer collaborator of several media news as a mental health counselor, including Univision 41, New York, and a guest speaker at different community health fairs, the Decide to Be Health program, and the Christian Community. Currently working virtual and online telehealth on both platforms as a psychologist at the International Training and Psychological Therapy Center and Personal Life Coaching at Hispanic Mental Health Counseling, PLLC. She's developed virtual and in-person conferences, consulting in behavior modification in children and adolescents, and positive parenting. She also specializes in adult stress, depression, anxiety, personal development, self-esteem, coaching, and her values are family, love, community, respect, commitment, and perseverance. And that concludes her biography.
All right, take it from here. Mateo.
Hi, good morning. I'm so happy to be with you guys. And the thing, my first presentation for my series is about vertigo. This is coming in my touch. There is a lot of people in this time with vertigo. Many people don't know what is vertigo is coming. Many people feel very addressed, very depressed, and some anxiety. Do they feel with the new version of vertigo all the time? When I in some meeting, I hear I have a vertigo. Oh my God, what is that? Okay, for me, it was very interesting looking for in the vertigo. And how is the impact of the vertigo mental health, emotional health, and the role of artificial intelligence? The most of the people I'm talking about they have vertigo, and here they don't have a referral for mental health counselor. Everything is done by the physician and by the neurology. This is why I feel that we need to go beyond that, because I so many, if I we get it, but we have many clients that have vertigo in our consultation. Vertigo, beyond being a physical symptom, generate a significant impact on the mental health and emotional health for patients. The disorders, such anxiety, depression, phobia, are common in people who suffer from chronic vertigo. However, there is a gap in integrated treatment that simultaneously address the physical and emotional aspect. Studies seek to explore this relationship and propose comprehensive therapy strategies. The goals is
if you can click the slide so we can see it also. Whenever you speak, the one that you're speaking, you click it so that we can see it. I'm sorry about that.
Okay. The goal of evaluation for psychology factor and development of comprehensive therapy. The general objectives analyze the impact of vertigo, the mental health and emotional health of patients, and development comprehensive therapy for model for this management. The specific is evaluate the prevalence of psychological symptoms, anxiety, depression, stress in patients with vertigo. Analyze the relationship between the intensity of vertigo versus with the deterioration. Identify therapeutic strategy treatment for vestibular and psychological support, cognitive behavioral therapy, mindfulness. Develop and validate the multidisciplinary intervention protocol to improve the life of the patient. All the eye roll, the evaluation and treatment, the intelligent artificial. Let me see 1 second. It's for put this. Okay. You see better now?
I don't see it. Do you see it? No?
You don't see my
It's only on the
presentation?
first.
Yeah, I will see
on
the
the first
presentation. We
slide.
also see verticals. You have to click on the left. If you click it in the left, it will show in the big one. Because you say vertigo number 1. If you click number 2, whenever you speak, whatever you speak, you have to click it.
Let's go. Up. Let's go. Let's go.
Mute Gloria.
Okay. The study is relevant due to the negative impact of vertigo on patient quality. Currently, therapy approach focus on the physical symptoms, leaving aside emotional well-being, which prolong suffering and increase the risk of psychological disorders. A comprehensive approach will contribute with improving the therapy outcome and patient quality.
In which one you are? In what number you are? What of the slides?
Oh my God. I know what. Okay. Do you want to present
Okay,
like
exactly.
that?
When you
Okay.
click it
Yeah.
like that,
Okay.
okay, you see?
Okay. Not a problem. I go. This study, I to explore the relation. Okay, I talking about that. Okay, this is like if I will make my research and look in this design, a missed study the quality and quantity sample with patient diagnostic with vertigo. And if we can make the investigation, we're looking with the person that is diagnosed in the first time with vertigo. I go for psychology therapy and with patient that is not taking the counseling with vertigo. How can be the difference between them? The intervention is implementation and evaluation of the combined therapy protocol of vestibular plus psychology therapy. Analyze the comparison pre and post intervention. The artificial intelligence play a good role now in this time because they have a model. I send the results, the SPER system. With the SPER system, they show the proposal of the SPER system is designed to diagnose a different disease related to vertigo. Health care professional make a accurate and time diagnostic. The patient select the symptom from the screen, and the SPER system can provide the diagnostic, the evaluation, and the treatment. At the end, I go to change how the person can assume the person say, I have dizziness, I have nausea, I have ringing in the ears. The SPER system go to say, oh, this is the kind of vertigo because there is a different kind of kinds of vertigo. Yeah. With the cognitive approach, I have later mentioned the medical, but I forgot to make the change in the slide. But I go to present the cognitive approach that why it's important to treat the vertigo. Psychology intervention can help to manage vertigo, particularly when it's associated with anxiety, stress, and maladaptive coping. The best psychological approach for vertigo often involve cognitive behavioral therapy combined with relaxation techniques and mindfulness. Below are key approach and proposed treatment plan. With CBT is the most important evidence-based approach for managing vertigo-related distress and secondary conditions like anxiety, fear, and falling. Goal address maladaptive self pattern contributing to the fear of vertigo episode or avoidance behavior. Cognitive restructuring help challenge catastrophic thinking. For example, if I get dizzy, I lost control completely. Many people that is experiencing vertigo has many cognitive restructuring that child catastrophic thinking like that. Mindfulness help the patient reduce the stress that exacerbate vertigo symptoms and increase emotional resilience. To goal, promote acceptance of the sensation without overacting or engaging in avoiding behavior. Reading exercise or remain calm during an episode. Mindful body scanning to identify tension and releases. Biofeedback and relaxation techniques is another one. Explore the therapy for anxiety, vestibular anxiety. Another technique is acceptance and commitment for therapy that we can use for treat vertigo. Education and psychoeducation. The goal, empowering the patient by helping them understand the mechanism of vertigo and the mind-body connection. The topic is how to address anxiety, accelerate the vertigo, the role of the vestibular system. We have a treatment plan for 12 sessions. I do not go to mention everything for less time for that we can share. For example, I prepared the session, the session for psychoeducation, conduct a detailed assessment of the patient, history, trigger, and psychological response to the vertigo. Provide education about the connection between anxiety and stress. Session the 3 to 6, I do not go to read all the sessions. I go to send the presentation. It's only that you can see how many sessions we can prepare for vertigo. If we go to do like some intervention. When we go to vertigo, as I was mentioning, this is coming with the most of the time is the doctor that is working with is the neurology, the physician, and sometimes they use the otorhinolaryngology for check for the ear and another specialty to looking for what is the kind of vertigo that the person can have the most of the time. Some medications are often used for alleviate acute symptoms, but are not a long-term solution. Peripheral causes like BPPV respond to best for physical therapy for minor, while central causes may require ongoing neurological treatment. To relocate the calcium carbonate crystal in your ear, if vertigo is very severe and causing significant distress, medication may complete psychological approach. For concurrent anxiety or depressed, they have some medication like antihistaminic, benzodiazepinic, diuretic, and steroid for any symptoms of the vertigo that the neurology can prescribe, or the psychiatrist for try the vertigo. There is very important when we go to treat the vertigo, the clinical history, like us to know the symptom, the duration, the trigger associated with the symptom, nausea, hearing, loss, tinnitus, etc. Past history, like a head trauma, migraine, infection, or stroke that can make causes for vertigo, or some medication too that the patient can is using. The physical examination, they're looking for the test, the head impulse test to evaluate the vestibulo-ocular reflex, Romberg test, check balance and coordination, test the plate maneuver. They're looking for vitamins D and calcium help to see if there is the disbalance for the crystal that can move in the system. Imagining tests like a MRI scan is the central cause is suspect. Audiometry to assess hearing in case to suppress Meniere disease. Electrostamography, ENG, or video nistramography to measure eye movement to evaluate balance system and function. And non-medication therapy. Canalin, reposition for Meniere, eso es, son tipo de physical therapy that they can do, like a vestibular rehabilitation, a life modification. There is many things that they can try for reduce the stress in the person, and they can sleep very well. The surgical is very rare that I was investigating for this procedure. That is the last chance that they can use for this. I was using some biography.
Hello, are you there?
Yes,
Evelyn?
I'm
Okay.
here. Sorry,
Blessings.
I started.
Okay, perfect.
1 sec. Some biography from my study about the vertigo. Okay, do you see the biography now? Okay, the biographies, I was looking in different research. I sent the investigation to you guys for you can read. And I have this that was very like for me when I was looking in the eye intervention. Yeah, PDF. 1 second, PDF. By PDF. 1 second. Okay, aquí va. Okay. I was mentioning before the ESSER program that I use for treat vertigo. This questionnaire, when the people choose with the screen, with the eye, if you see here, in the screen for the eye, they have a screen that the person go to see where is that is coming of vertigo, what kind. The person, they say, okay, you have this, the eye go to make the diagnostic. It's very faster, timely to provide the diagnostic. And they have the treatment and the medication and the another study they need to use the tool for evaluate and for make the confirmation. This is the 8 kind of verticals that they was mentioning. For example, is the patient present with sensation of spinning, whirling, or tingling of the environment on set. They consider the possibility of vertigo. Is the vertigo is accompanied with symptoms of nausea and vomiting, sweating, and difficult standing or walking today, considering the vertigo peripheral vertigo. They have different kinds. As soon the patient go to say, I have this, they go to mention, okay, this is with the eye. They say, oh, you have this, they give you the treatment. if you have any question.
Yes, excellent presentation and in-depth, research on vertigo. I like it a lot. I know that if anybody is suffering from vertigo, they can have an idea of the complex case of vertigo, and also we're gonna have also the slides and the whole presentation for those who want it. We're gonna post it inside the YouTube presentation, but also let me ask you, Mateo, uh, you suffer from vertigo. Tell us about your history of vertigo yourself. How did it happen? What is the cause? Do you have any cause? Is psychological or it's physical? Do you have a vestibular or left or right kind of disorder in your physical disorder in your ear? Have you been physically diagnosed with vertigo in the sense of the disease?
The first thing when you go to the neurology, in my experience, I was looking why everything like that. The first thing they give you medication. I went to 3 neurology and they never sent me for counseling. But my problem is coming. I have the tinnitus symptoms and the
Okay.
spinning. And this is why I went to see my doctors to see why I experiencing that symptoms. And it's very, very, very hard because it's both the continuous symptom for tinnitus
Mm-hmm.
and sometimes the vertigo. And this is not very easy for a person if don't have a challenge for doing in that. It's very hard. After I was here and say, oh my God, let me start. Let me look in my mindfulness. Let me get it for what, because sometimes you get a start, like I said before, that you say, oh my God, the person is concentrated. I cannot do anything. You forgot many things about your life, but when you go beyond yourself and looking inside, you say, okay, I need to stand up. I need to make suggestion to the doctor. Uh, Make me this, make me the, give me that, because it's not only medication. The medication is only for alleviate for a little bit of symptoms, but you need to treat with your real life. Before that, if the person don't go sleep all day, they need to look in counseling. They need to look some mindfulness. They need to look exercise. They need to look different approach for treat the vertigo and the tinnitus when it's both symptoms together.
Okay, so although it might be a physical, it's also a psychiatric and psychological disorder,
Neurology.
a neurological disorder. So you have to have a physical checkup, you have to have a neurological checkup. Also, you have to have even some auditions kind of audiologist checkup.
Yes, that is the otorhinolaryngology. It's like a file or see a physician, because the physical therapy is another one for treat the balance and balance with the person have vertigo.
Exactly. So you have to have a physical. You can have a lab, so to see if there is any issue with any kind
Vitamin
of
D.
vitamin D. If it's in deficiency vitamin D, then you have to check your ear, and you have to have the neurological, the psychiatric components, and also you have to have be evaluated for medication therapy if you need some antihistamine kind of also
Yes.
treatment or anxiolytic treatment for. So it's a very kind of complex pathology. In my life, I've seen probably 3 or 4, 5 cases of vertigo, and they come because they've been diagnosed with Meniere syndrome, which is the Meniere syndrome. Is already a vestibular kind of internal ear dysfunction, which is associated with the tinnitus, this dizziness, especially for nausea. There is a lot of nausea into this Meniere syndrome, which most like the extreme case, and there is always associated with the vertical, the Meniere case, some kinds of depressions of anxiety or connection with emotion. So, is it then a psychological a mental or physical disorder, the vertigo? How do you see it yourself?
It's physical, but we need the mental health and the counseling for three, because when people get it in the first time and continue with that, you get very stressed. And if you don't go and treatment, was like if you can control your anxiety, if you can control your stress for have the symptoms in your life, because remember, when your body is imbalanced, your head is looking at that. You can get the catastrophic saying, "Oh my God, I cannot stand up. I cannot do my life. I cannot do this forever." If you can control your anxiety, you cannot go away. Uh, is the person is in counseling in the first time the neurology treats this with the counseling. I saw the person don't go to need medication because the medication go to put the person asleep. The medication go to put the person away. I know if the person need the medication, they need to take it. But if the neurology or the physician, when they see that there is a combination that the person is getting a lot of anxiety, a lot of stress, they need to treat with the counselor for avoid the most physical and avoid most emotional distress, because they got worse. It's not treat in the first time, they get it worse, worse, or worse. They go to do a lot of benzodiazepine for go to sleep, a lot of medication for control your anxiety. And when when the person is taking a lot of medication, the life and for thinking go more slow.
Mm-hmm. So we have antihistamines, mesclizins, dimenhydrinase for mild vertigo or motion sickness. We have benzodiazepines, diazepam, short-term use for acute vertigo, diuretics for Meniere's disease to reduce fluid buildup, and also we have steroid for vestibular neuritis if inflammation is suspected. So, I mean, like you have to have like really a physical medication therapy checkup for vertigo. So it's not that simple. It's a very complex kind of.
Yes. Yeah, and I know we as a counselor, we need to be prepared.
Mm-hmm.
Because if you many people do not talk about that, but if you go a relationship with friends and you say what's wrong, or you are involved like me go involved in many community with different kind of people and chairs in the community, the most of the time you hear the people say, "I have vertigo. I don't know what I need to do. This is getting me crazy." And we are counselor, we need to be prepared, because it's the neurology and physician and repair. We have our office full of patients. And we, as psychology, we need to be prepared, because if we help the person to be relaxed, the person do not go to be anxiety, the person do not go to be depressed, the person do not go to be insulated, because I know many persons get insulated. And after the COVID, this is, I do not investigate too much about that, but many people in the minds, and this is happening after the COVID. This is happening because I put in the COVID vaccine. This is another thing that we need to investigate more, because they said there is no a confirmation, but this is something that the person feel more after that. This is something that we need to exacerbate, we need to looking for. Be careful, do not say, "Oh yeah, this is because you was vaccinated." We need to go over the treatment, we need to go over the symptoms, and do not make a specification. "Oh yeah, this is for that." We need to be very careful with that when we go to treat the person with vertigo. I'm sorry, I saw Bedina with the hands.
Yeah, Dr. Medina.
Well, thank you for sharing with us this great presentation, Evelyn. So my question to you is, given that we are currently, are working with research and development in neuropsychology with the Triple M project. So you feel that counseling for people who deal with vertigo is a very important, and do you feel that if they are able to understand the symptoms and the origin where it comes from, because I see in the last slide here that you are talking about being associated with anxiety or sort of like a depression. Because in my experience, my understanding that vertigo was something neurologically, not something that had to do with the psyche. But this is something very new to me. So can you please elaborate a little bit more on that? Because I know a few people that have to deal with that and who have been diagnosed with it, but this part that you are presenting to us today is something that is relatively new to me.
Yes, with the person, it is neurological. It's neurological. But remember, when you have neurological symptoms, it's the pain, because in the brain, you go for the neurological, they're not looking for what is wrong. You made the MRI, you made the CAT scan, and different tool that I presented before. But when the person feels stress, because when the person feels, the most of the time, as I hear the person experience, they say, oh, my mind getting crazy, I'm getting spinning, I don't know what to do, what's my life. We need to look in what the person is suffering, what the person is feeling, because many persons can say, oh my God, I prefer Bill die to present them with that. I do not go my life if I continue like that. Because, for example, if the person is a professional that generate a lot of money and need to be all the time in the street and have the vertigo, the person can get in shocking with anything. If the person have a lot of dizziness, they cannot take right now a decision for something. And this is something that may stress the person. If the person gets stressed, because maybe the person don't need a counselor, but the most of the time need a counselor. Because many see, okay, they made the CAT scan and they give you the medication. Sometimes they give you the medication and the person don't know what medication is for off. And the doctor give you the medication like a colbacetine or mesicline for reduce the dizziness, and another for may control the anxiety. And in my understanding, if you need the medication, it's okay for treat the anxiety, because it's not psychiatric, but can be a psychiatric if the person cannot manage the anxiety, the symptoms that produce the anxiety, or can manage the stress that is present in their life. Because it's not necessary to go to the psychiatric, but the most of the time, for I hear you, they give you, the neurology give you the medication for reduce the anxiety, because the person get a lot of anxiety when have the symptoms. This look like you need to be laid down in the bed. If you close your eye, you feel that your head is spinning around, everything is moving around you. Your life getting very stressed because you cannot do everything that you want to do. If you are professional. Even so, if you are not professional, is working in the street, the person that, for example, mother that all the time is at home, feel frustrated because cannot stop in the stuff cooking. Because if I get a disease, they say, oh my God, can I bear myself if I'm doing the cooking? Because many people have all the vertigo is not the same, but many people have very chronic vertigo that cannot have anything that can be dangerous for her life. In the person with vertigo, we need to looking for symptoms that the person can be feel like a suicide or have idea for kill themselves.
Excellent. Let's give a chance to Mario Zoom and Evelin, the other Evelin Fonseca or Gloria Jean Baptist to have a comment or a question. So the microphone is open to you guys.
Thank you, Evelyn. I really enjoyed your presentation. It was definitely insightful for me. I don't know anyone that has vertigo, and I had no idea how complex it was once you get that diagnosis. You know, and I also wasn't familiar with the treatment that you would be using, you know, as I think about it, mindfulness and the CBT. I guess CBT wasn't something, I thought of it more as, you know, some kind of medical ailment, and that there was either surgery or, maybe physical therapy, but I wasn't thinking of the other component that kind of a diagnosis. Of course, if you can't manage those symptoms, then it does kind of become a mental health issue. So thank you for bringing all of this. And it was so well researched, very thorough. I've learned a lot. And now if I have anyone that crosses my path, I will know what to do, at least for the mental health component. Thank you again.
Yeah, I'll jump in really quickly as well. I thought it was a great presentation, very, very informative. And this is this relates to something that I feel very passionate about, that chronic illnesses and mental health go hand in hand together, and they need to be treated together. I feel that most or all chronic illnesses create some kind of mental distress in patients. And also, most chronic illnesses, or most people who have chronic illnesses, definitely need coping skills, because not only do chronic illnesses create mental distress, but most chronic illnesses flare-ups are caused by stress in people. So they definitely go hand in hand, and this is just, you know, another example of how important it is to treat both together, because they do go hand in hand. And most likely, if you're dealing with if you're dealing with chronic illnesses, you're going to deal with mental health issues, even if it's just learning coping skills. So yeah.
Thank you so much.
That's great. Gloria John Baptist?
Yes.
Right.
Great. I want to thank Evelyn. I think her presentation was exceptional in that it added new information. Speaking from a personal standpoint, from my role as a clinical practitioner, I saw an opportunity to become more aware when in the process of diagnosis, in looking at those symptoms from vertigo, simply because I am seeing a relationship and similarities in some of these symptoms that could be diagnosed from a clinical standpoint. So now what I'm seeing here is an ability to think further, to think outside the box, if I should be presented with a patient who might be displaying these symptoms. It's a new area, and I say new in the sense that her research has shown relevance to a complexity of complaints or symptoms that could be treated clinically and not just left unattended to. Thank you again. I think it was a wonderful presentation.
Unmute. Let me ask Evelyn. Ask to unmute. Unmute. So there is a very kind of relationship with many of the chronic diseases and emotional psychological, as Evelin Fonseca and Evelin put it together. Evelin? Go again. Let me ask you again. Let me ask to unmute, and then you click. So in the meantime, I'm gonna continue talking. As soon as you open up your mic, but like for example, you see dizziness, tinnitus, nausea, anxiety. So if we got a problem with movement to the right, to the left, which is very close to vertigo. So do we have a specific kind of disorder like Meniere's syndrome or vertigo who have to be persistent and have to change your life with your kids, with everybody to make the diagnosis? Because you're going to say, well, it's vertigo or Meniere's syndrome because a very debilitated kind of disorder and disease that had a lot of multifactorial and multi-team intervention. So we have to clear if it's only emotional or if it's physical, because it will affect the quality of your life. So what is your final recommendation for those patients who are suffering from vertigo and they don't know that it could be connected to a psychosomatic disorder? For example, asthma, cancer, diabetes, heart diseases, stomach ulcer, depression, those are psychosomatic disorders. If you just treat the medication and you go to the doctor, it's going to be in the evolution and the quality of your life going to be changing. So what are those recommendations that you will suggest, Evelin Mateo?
I suggest to do all the evaluation. This is the first thing. Go to the doctor, get the all evaluation, and ask for possibility, what kind of treatment they propose. And the person I suggest, we need to read, because many doctors only take the first hand is only medication. Sometimes, maybe don't need the scan, and sometimes do not find anything in the scan and only want to give the medication. Do not make another recommendation. We need to read about for any kind of disease, we need to read about and looking for what is coming for my life, because I do not mention it before. It was like Dr. Piña said, this is affect any medicine, affect many part of our life. And maybe we need the sexual therapy, different kind, because this is affect the family. When the person is taking medication, this is affect the sexuality, because if the person is not educated, at what time you need to take the medication, they go to have problem in the relationship with the partner. Many anxiety person and depressed person have problem with the couple because they do not know in what time use the medication. If the person feel, okay, I go to take medication, the doctor say, go to take medication before go to bed. And you know, the time, do not say to the couple, I need to take medication because I feel very bad today. And the person go very prepared for that time, you know, will be very hard. For the family, it's no hard time for dedicated time. Many times, it's not only counseling. Some patients need couple, some patients need family, but the treatment on time get better result. Only no medication. We need to do educated. We need coaching, looking for coaching, because it's no need like a big counseling, can do like a coaching for deal with the life. But the psychological approach, mindfulness, everything go to health. The good thing for work for that is very, very, very useful.
That is true. And in terms of sexuality, if you're having sex and you cannot move, because if you move, you have tinnitus, and then you have nausea, it's very difficult to move and have any kind of exercise. So not only the medication that you use, because that might be changed, but the symptom itself can compromise your sexuality, your family, your life completely.
Yeah, for the side effect, the medication.
The side effect of medication. Excellent. So yes, great presentation, great research we have for today. This is the CURA100 AI podcast. This is our second episode. So we have a quality of researchers and presenters every Tuesday from 8 to 9, and we are streaming live or wherever you are. So welcome and thank you, everybody. Thank you, Evelin Mateo, for your great presentations. Our teams, Evelyn Fonseca, Kari Mariusum, Evelyn from Chicago, Kari Mariusum from Turkey, Juan Carlos Mira, I don't know if he's in New York or in Santo Domingo. He's just a traveler. And Gloria Jean Baptiste, she is in Brooklyn. And Evelin Mateo, she is in Yonker. And I'm just streaming from Kissimmee, Florida. What a beautiful time that we have today with the AI intelligent analysis that we can do. We are recording this live, and also we have an AI summary that will be sent to you guys who are watching us today. So thank you very much. And we're going to have every Tuesday one of podcasts. It's a discussions of research, or the most pressing research in terms of mental health and AI together. Thank you, and see you next